Well, good morning and welcome to Karen's Corner. I want to introduce Carolyn Jenkins with Pathways Counseling Services in Oxford. How you doing, Carolyn?
I'm good this morning.
It's
Thank
good to
you.
see you.
You
And
too,
it's nice to
Karen.
see your lovely office too.
Thank you. You see a blank wall back here.
Well, it's still very well appointed, so I know having been there, it's a beautiful place. So
Thank you.
Carolyn, how long have you been in private practice?
I've been in private practice for about 4 years, but actually 1.5 independently.
Okay.
Yeah,
And so you've been in the field, I'm sorry, how long did you say?
about 4 years.
4 years. Okay.
Mhm.
And what led you to this field, to this line of work?
As a lot of therapists, my own history, growing up, a history of trauma myself, and working through that myself. And then as I was a student in grad program, I worked with the addiction treatment center here, the Oxford Treatment Center, and working in that field and seeing so much trauma in the groups and independently with the clients, trying to figure out how to help them the best way I could. And met Dr. Adrian Hickman, and he sent me down to Judy Crane to get that training in trauma. And that was the only name he would give me when I asked him, where do I get trauma training? And started working with her, and it was a blessing. Did a lot more of my own work with her too, so it was great.
Yeah, it's important to do our own work.
Yes, especially if we're going to be doing trauma work.
Absolutely. And so that kind of answers my next question, which was what your specialty areas are. And so obviously it's trauma and the treatment of trauma.
Mm-hmm.
And so what modalities do you utilize to treat trauma?
Client-centered is my biggest, but a lot of experiential work. Meeting the clients where they are and using different modalities like art therapy, sand tray work, just a lot of different expressive modes to where if they can't speak and talk about it as much, then giving them a different modality to be able to express and release some of that trauma.
Okay, very good.
Yeah.
And what insurances do you take?
Blue Cross Blue Shield. That's
Okay.
the only one at this time.
I gotcha.
I do have a cash rate and a sliding scale for clients too.
Okay, that's great. Good to know. So what differences have you noticed between in-office therapy and telehealth? I'm guessing you're doing a lot of telehealth these days.
Actually, I'm still doing a lot of in-office.
Really? Okay.
I am. Most of my clients prefer in-office, and so I meet them where they are. We social distance inside in the session. I sit at my desk, which I normally do not do, so that I'm against one wall, they're against the other. And we, sanitize and follow all the guidelines. But telehealth, I was doing a lot in the beginning. And when I realized how long this could go on, I just offered my clients both. And the majority want to be in the office. So we're doing most of that. I do have a few that are doing telehealth. Some that are, more susceptible to COVID, if they have some other type of disorder. But I keep my clients 30 minutes apart so that we're not having anybody in and out of the waiting rooms at the same time.
That makes sense.
So that's been beneficial.
Okay.
But yeah, the telehealth I'm not crazy about. To be honest, I don't know too many people that are. But
I'm hearing very different things from different people. So it really, I guess it just depends.
Yeah, it's exhausting for me staring at a screen all day, not being able to read the body language and, all of the good things that come along with in-office sessions. So yeah. I prefer the in-office by far.
Okay. And are you noticing an increase in any specific conditions as a result of the pandemic?
A lot of anxiety, some depression, a lot of loneliness, even from couples that I've talked to. It's like, they're not getting together. They're not going out to dinner with other couples. They're not socializing. And so they feel very isolated. And loneliness is such a huge factor right now in our society. Yeah. So many people are around a lot of people, but they're not connecting.
Exactly.
Especially women. I'm seeing a lot of loneliness in women.
Okay, well, that's interesting. So, what would be the best way for someone to reach out to you to schedule an appointment?
You can go to my website. It's www.pathwaysoxford.com, or you can give us a call at 662-561-5588.
Great. Is there anything else you'd like to mention before we wrap up?
Not at this time, Karen. I just am grateful for the interview and the time we got to spend together this morning, even if it was brief. I miss seeing you too.
Yeah. Well,
Yeah.
thank you again for your time, Carolyn. It was great to see
Well,
you.
you too. Thanks,
Take
Karen.
care.